I feel like he just disappeared. I don't get it.
There's no neck pain anymore, right? So tell me exactly what's going on with your condition, please.
I have a lot of neck pain,
Okay.
neck pain and stuff, and also my back hurts.
So how long did you have this problem for?
Maybe like 3 years.
3 years you had this problem for. So I want to be able to ask you, what are the things that you couldn't do because of this ongoing neck pain?
I couldn't sleep. It was hard for me to sleep.
Do
And
you-
also to turn my neck.
Turn your neck is difficult, and then just out of curiosity, can you just go and turn your neck for me, please? How long has it been like that for?
3 years.
Just 3 years also. And then what type of the work you do?
I work on a warehouse.
So a lot of heavy lifting, things like this. So when you do a lot of heavy lifting, do you feel like there's a lot of neck pain, even more neck pains that are ongoing?
No, but like in the day, just because I'm already got used to it.
Mm-hmm.
And see, you know, I'm already used to it, but when I get to my house and I'm trying to sleep or I'm trying to relax, it just, I
Gotcha.
know it's uncomfortable. When I wake up with a lot of neck pain
Gotcha.
and a lot of back pain.
So funny you mentioned about back pain, because I noticed that you have not mentioned about your lower back pain, but I do want to be able to ask you. You do have a
When I say
lot.
look back, it's like the whole back here.
Oh Lord! So you have the entire thing is actually hurting you.
It hurts here.
If I go here, it hurts right here.
Inside, yeah.
If I go here like this, how does it feel like?
Yeah.
It hurts here.
Mm-hmm.
Like this, then you have a pain right here.
Yeah.
Just without going any further, I want to be able to let you know I see a lot of swellings on this side. So I want to be able to show you. I wish if you brought your wife here with, so I can examine this with her. But if I actually press you over here, it comes right back. This actually, my friend, is fluid right here like this. I'm actually outlining it for you right now. Like this. It's all swelling, edema, fluid, swelling. Your entire mid-back, my friend, is swollen as heck. So, and then you wonder why you have neck pain. Your neck is painful, yes? Turn your head. You cannot turn your head a little bit. Turn your head. It's difficult, right? You know why it's difficult? Because guess where the movement or the motions of your neck is coming from? Comes from here. In fact, your actual movements of your neck, it starts from here. Speaking of which, your lower back is also swollen, and all this that I see is also fluid. So if I can actually outline it, it's like this. Your neck movements start from your lower back areas. So let me do something really, really cool trick. I want to be able to show you really, 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 really cool trick. Turn your neck to the left side. Turn, not so much, right? Turn your head to the right side. Not so much, right? I found a problem on your x-ray around this area. 5, 4, 3, 2. Pain right here, yes? I'm going to press on it here like this, just a little bit. Now go ahead and turn your head to the left side. A lot more.
What the?
Turn your head to the right side. A lot more. I didn't do anything to your neck. All I did was that I just put pressure on the painful areas on your tailbone, and you're able to do it. Go ahead and then bend your head back. That's how much you can do. Bend your head backward. That's how much you can do. I'm going to put the also pressure right here. Go ahead and bend your head all the way down. Crazy, right? Crazy. You get even twice as much motion just by me putting pressure on your tailbone areas. Another problem area that I actually found on you. 1, 2, 3, 4, 5, 6, 7, 8. This was also another painful area. This is really direct area for you to have neck movement. So before I do anything else, go ahead and turn your head to the left side again. That's how much you can do. Right side. Bend forward, forward, bend forward, bend backward. I'm gonna put some more pressures here like this, okay? Just one finger. Now go ahead and turn your head to the left side. Wow. You see the differences?
Yeah.
You see the differences? Crazy, huh? And the reason why I have known that you have ringing of the ears is because this back right here, middle part of your back, also goes to your ear nerves. It also supplies your ear. So if you get ringing of the ears, usually comes around this area. Right about here, you also have a pain around this area, yes? That's also responsible for somewhat of your kidney functions. And you have pain around this area. This is actually for your knees, L4 areas. Going down over here. You also have a, this is the first bone that I have pressed for you to turn your neck back and forth. This is sacrum. That actually is responsible for any kind of foot pain that you actually have. So everything in your body is related here like this. Does it make sense to you? So I guarantee you're gonna have a lot less neck pain just by me taking care of those those 4 bones, and I'll be able to show you how. Pretty wild, huh? You have somewhat of a very aggressive curvatures in your lower back area like this, and suddenly it stacks all the way up to right about your collarbone is. You see that, right? Yeah. I can put a pen right here and it kind of stacks up all the way up here, like a leaning tower of Pisa. It stacks right up, right? From all the way on, after that you have somewhat of a curvature here, and you try to have another curvature going all the way up to up here. And you might be asking, okay, Zachary, so what? So what's the big deal? It is a big deal because in order for you to be able to have this kind of curvatures and then have this kind of abnormal leaning of your entire spine to left side and having such an abrupt curvatures here, my friend, that's the reason why you have a neck pain. Not because you woke up wrong in one day, not because you have some kind of a neck issues you're born with it, no. Because the fact that your entire spine is curved this way, and then this amount of your entire torso here is leaning toward the left side, and then somehow your body's trying to compensate and then trying to look to the right side. All the pressures of your entire torso, entire lower back, resting on this base of the neck, and then also upper mid back. That's the reason why you have such a intense, shocking, sharp pain to your neck. Because of that. Because your neck is not supposed to be enduring all that pressures. I'm gonna make a contact. You're not gonna fall. Don't worry about that. There we go. Now, get up slowly. Walk around and tell me how you feel. Move your neck, move your neck.
Can move.
Turn around and then see how that feels. Move your neck left, move it to the right. How does that feel? Much better, right? After one bone. How much of your neck pain do you have after one bone treatment?
Not in the moment, I don't have right now.
You came to see me with a 6 out of 10 neck pain today.
Yeah.
How much do you have right now? 0 to 100%.
I would say a 3.
So you're telling me 50% of the neck pain that went down after one bone treatment in your lower back.
I feel like it just disappeared. I don't get it.
There's no neck pain anymore, right? Was I close to your neck? No, I was in your tailbone. I was in your sacrum.
Wow.
Crazy, right?
Yeah. So inferior.
There we go. Move your neck to the left side, right side, down, and then back. How much of reduction do you feel?
I feel more.
You said 50% before. What is it now?
Yeah, I feel better. I just feel like it's going away little by little.
Little by little. What is the number?
I would say also 2, 3, but like I just feel like more loose.
More loose.
Yeah, because I also feel like a lot of tense.
Yes.
No,
We're far away from neck, my friend. Far away from the neck.
And you're down here.
Yeah. There we go. All right. Tell me how you feel after the third bone. Turn left, left, right. down, all the way up. How much of neck pain do you have now?
Yeah, I feel more relief.
More relief, right?
Yeah.
Much better. Hey, you can actually turn your head side to side now.
Yeah.
We're so far away from the neck. Let it down. Let your shoulder down. Go ahead and do left, right, down, all the way up. How do you feel?
Every time more loose.
More loose. You said 50% after that, and then it's getting small. What do you think after our fourth one? Give me a number, 0 to 100%. How much of neck relief do you feel?
I would say 80 relief.
80% relief.
Yeah.
We're so far away from the neck, my friend. I'm going to make a contact right here. You heard that too?
Yeah.
All right. Okay, go ahead and turn head to the left, right, down, all the way up. How do you feel?
Feel better.
You say 80%. What is that number like now?
Still, I would say 85. It's getting loose.
Getting loose?
Yeah.
You can actually turn your head left and right now, right?
Yeah.
Oh, look at that. That's pretty nice. That's pretty amazing. And you heard that too. That was the last one. Go ahead and turn your head to the left, right, down, up. How does that feel?
Every time you feel more relief.
After me taking care of several bones of your neck, how do you feel?
I feel way better than how I came in here.
But let me ask you something, and I think this must be true. You felt the most amount of differences when I did your tailbone, the lowest back one, right? Not your neck.
Yeah, exactly. When you did the first one, the second one, I feel that's where I started feeling.
What does that tell
difference.
you? You felt the most amount of the first and second one. You know why? Because that's your biggest problem, not your neck. Yeah.
Hi, this is Dr. Lee. Let's compare before and after. Notice how much it can bend his neck forward just by me putting my hands on his actual problem area, his sacrum. It's important to know that there has not been any treatment at this stage. Just by putting pressures on his tailbone area, he is actually having his root cause of his neck problem, which is lower back, to be removed in the equation. That's the reason why he feels better. Thank you very much.